according to NCBI 2020, current estimates for prevalence are 6 to 7% for ischemic spondylolisthesis by the age of 18 years, and up to 18% of adult patients undergoing MRI of the lumbar spine. Grade 1 spondylolisthesis accounts for 75% of all cases. Lumbar spondylosis is present in 27 to 37% of the asymptomatic population. In the United States, more than 80% of individuals older than 40 years have lumbar spondylosis, increasing from 3% of individuals aged 20 to 29 years. The estimated prevalence of this herniation is approximately 1 to 3%. The highest observed incidence is between 30 to 50 years, and it is more frequent in men than in women, ratio 2:1.
Good morning. I am going to discuss about the spondylolisthesis. So what is spondylolisthesis? Spondylolisthesis is a condition involving the spine stability, which means the vertebrae moves more than they should. A vertebra slips out of place under the vertebra below. It may put pressure on a nerve that causes lower back pain or leg pain. Most cases of spondylolisthesis do not cause symptoms. There are types of spondylolisthesis. The first one is the congenital spondylolisthesis. It occurs when the baby's spine doesn't form the way it should before birth. The second one is the ischemic spondylolisthesis. It happens as a result of spondylolysis. The crack or fracture weakens the bone. And the third one is the degenerative spondylolisthesis. It is the most common type. It happens due to aging. Over time, the disc that cushion the vertebrae loses water. As the discs become thin, they are more likely to slip out of place. There are also less common types of spondylolisthesis. The first one is the traumatic spondylolisthesis. It happens when the injury causes the vertebrae to slip. The second one is the pathological spondylolisthesis. It occurs when a disease such as osteoporosis or a tumor causes the condition. And the third one is the post-surgical spondylolisthesis. It is the slippage as a result of the spinal surgery. Now, how common is spondylolisthesis? Spondylolisthesis and spondylolysis occur in about 4 to 6% of the adult population.
For the causes of spondylolisthesis, first, the type 2, also called ischemic. This is the most common kind of spondylolisthesis. With type 2 spondylolisthesis, there's a problem with the pars interarticularis, a particular region of your vertebra. Ischemic spondylolisthesis is divided further. First, the type 2A. Gymnasts, weightlifters, and football linemen are especially prone to this kind of spondylolisthesis. It caused by multiple microfractures on the pars interarticularis, microfractures that occur because of hyperextension, overarching, and overuse. The pars fractures completely in type 2A. Second, the type 2B. This is type also caused by microfractures. The difference though is that the pars don't fracture completely. Instead, new bones grow as the pars heals, causing it to stretch. A longer pars can then cause the vertebra to slide forward. Third is the type 2C. Like type 2A, this type has a complete fracture. However, it caused by trauma. The impact in a car accident could fracture your pars. For example, a pars fracture can lead to a mobile piece of bone. The detached inferior articular process can actually move around. This bone fragment, also called a gill fragment, can pinch the exiting nerve root, so the bone may need to be removed. Problems with the pars interarticularis can also be called spondylolysis. The word looks like spondylolisthesis, and they are somewhat related. Microfractures in the pars interarticularis, the kind that gymnasts, football linemen, and weightlifters are prone to, are a form of spondylolysis. The fractures are called spondylolysis if the vertebra slips forward because it's not being held in place properly. It's called spondylolisthesis. For the type 3, aging can also cause spondylolisthesis. As you grow older, the parts of your spine can degenerate. They can wear out. Usually, your intervertebral discs change first. The older you get, the less water and proteoglycan content the discs have, and less fluid makes them less able to handle movement and shock. Less fluid can also cause the disc to thin, and a thinner disc brings the facet joints closer together, without the disc acting as the cushion. The facets can control the spine's movement as well, and they become hypermobile. Eventually, a vertebra can slip forward because the facets aren't holding it in place effectively as the spine moves. The type 3 spondylolisthesis usually happens at the L4 to L5 region, the 4th and 5th vertebrae in your lower back, and it's more common in women older than 50 years old. For the type 4, similar to type 2C, type 4 involves a fracture. However, it's a fracture of any other part of the vertebra other than the pars interarticularis. Your facet joints, for example, can fracture, separating the front part of your vertebra from the back part. For the type 5, tumors on the vertebra can also cause spondylolisthesis because they weaken the bones and can cause fractures that split your vertebra, leading to instability and a potential slip. For the type 6, you have this type of spondylolisthesis. Surgery causes your vertebra to slip forward. It's also known as iatrogenic spondylolisthesis, and it's caused by a weakening of the pars, often as a result of a laminectomy, a typical back surgery, but type 6 spondylolisthesis isn't a typical result of the surgery. As a quick summary, spondylolisthesis can be caused by 1. A birth defect, 2. Fractures, 3. Spondylolisthesis, a defect or fracture in the pars interarticularis, 4. Degeneration due to age or overuse, 5. Tumors, and lastly is surgery. So let's discuss further the types of spondylolisthesis. There are 6 different types of spondylolisthesis: the traumatic, iatrogenic, congenital, degenerative, pathologic, and ischemic. This type of structural abnormality of the spine can be found in all regions, example cervical, thoracic, and lumbar, but most frequently occurs in the lumbar spine. Congenital spondylolisthesis, also known as dysplastic spondylolisthesis, is an abnormality present at birth. Thus, belief in this type of spondylolisthesis is a defect in the facet joints which connect spinal vertebrae. This occurs in the lower joints at L5, inferior joint, the upper joint at S1, or what we call super joints, or at both joints, and cause a gradual slip of the L5 vertebrae over time. This type of spondylolisthesis is rare compared to other types. The ischemic spondylolisthesis is the most common type of spondylolisthesis and is divided into 3 types, separate subtypes, but all have a defect at the same location in the spine. In ischemic spondylolisthesis, there is a defect, typically a fracture of the pars interarticularis, the bone that connects the upper and lower facet joints. This fracture prevents the affected vertebra from staying in line with the other vertebrae, allowing it to slide forward. The L5 to S1 level is most frequently affected by ischemic spondylolisthesis. The third one is the degenerative spondylolisthesis, is a slip from arthritis within the spine. Degenerative changes or arthritis is common in aging individuals. Once the joints in the spine begin to wear, they have difficulty keeping the spine in line and a vertebra slips forward. This occurs most frequently in the lumbar spine but can happen in the cervical spine as well. The fourth one is the traumatic spondylolisthesis. It's a slip due to an event that places a large amount of force on the spine. This high force results in damage to the neural arc, which is the ring of bone that surrounds the spinal cord. The fracture of the neural arc causes a sliding forward of the vertebrae. Both the cervical and lumbar spine may be affected, but this is an uncommon type of spondylolisthesis. Next is the pathologic spondylolisthesis. It's a slip that from weakness within the bones, such as tumors, types of cancers, and bone diseases. This weakening causes destruction of the posterior or backside portion of the vertebrae, such as the neural arc which surrounds the spinal cord. Just like the traumatic type, pathologic spondylolisthesis is a rare type. Lastly, the iatrogenic spondylolisthesis is a slip caused directly from a prior spine surgery that involved the compression of the spine without stabilization. During the compression procedure, a small amount of bone is removed to release pressure on the spinal cord and the nerves that branch off. The removal of too much bone during this procedure can cause the vertebral body to slip. In general, this is avoided using a stabilization surgery when a large portion of bone needs to be removed. For the spondylolisthesis symptoms, sometimes people with spondylolisthesis don't notice anything wrong. Symptoms include first, the lower back pain, second, muscle tightness and stiffness, third, pain in the buttocks, fourth, pain spreading down the legs due to pressure on nerve roots, fifth, pain that gets worse with an activity, sixth, tight hamstrings, and lastly, trouble standing or walking.
Spondylolisthesis is further classified into grades according to how far out of place the vertebra is. The grades are: Grade 1, 25% of the vertebral body has slipped forward. This is the lowest grade. Grade 2, between 25 to 50% of the vertebral body has slipped forward. Grade 3, between 50 to 75% of the vertebral body has slipped forward. Grade 4, between 75 to 100% of the vertebral body has slipped forward. And grade 5, the vertebral body has completely fallen off and looks detached. For the complications, serious spondylolisthesis sometimes leads to another condition called cauda equina syndrome. This is a serious condition in which nerve roots in part of the lower back called the cauda equina get compressed. It can cause you to lose feeling in your legs. It also can affect the bladder. This is a medical emergency. If left untreated, cauda equina syndrome can lead to a loss of bladder control and paralysis.
For diagnosis and test for spondylolisthesis, healthcare provider will do a physical exam and ask you about your symptoms. You will then likely need imaging scan to confirm the diagnosis. Here are the two imaging tests for spondylolisthesis. First is a spinal X-ray, and it helps healthcare providers see if a vertebra is out of place. Second is a CT scan or MRI scan. This may be necessary to see the spine in more detail or to see soft tissue such as disc and nerves. Non-surgical treatments available for spondylolisthesis includes: first is the rest. Take a break from the strenuous activities and sports. Second is medication. An over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen can bring relief. If does not work, your healthcare provider may prescribe another medications. Next is injections. You receive an injection of steroid medication directly into the affected area. Next is physical therapy. A physical therapist can teach you targeted exercise to strengthen your abdomen and back. Daily exercises often relieve pain after a few weeks. And lastly is the bracing. A brace can help stabilize your spine. The brace limits movement so that the fractures can heal. Braces are not available or not used in adults. Surgery for spondylolisthesis. You may need surgery if you have a high-grade spondylolisthesis. The pain is severe or you've tried non-surgical treatments without success. The goals of spondylolisthesis surgery are two. First is relieve pain from the irritated nerve. Next, to stabilize the spine where the vertebra has slipped. And last is to restore your function. What happens during surgery of spondylolisthesis? Surgery for back pain due to spondylolisthesis typically involves spinal decompression with or without fusion. But studies show fusion without decompression may give better outcome than decompression alone. During decompression surgery, surgeon removes bone and disc from the spine. This procedure gives the nerve space inside the spinal canal, relieving pain. And during fusion surgery, surgeon fuses or connects the two affected vertebrae. As they heal, they form into one bone, eliminating movement between the two vertebrae. You may experience some limited spinal flexibility as a result of surgery. Will spondylolisthesis come back? Most of the time, pain is gone after you recover from the spondylolisthesis surgery. You can gradually begin to resume your activities until you are back to full function and movement. After treatment, how can I prevent spondylolisthesis from returning? Your healthcare provider may recommend exercises to strengthen the back and abdominal muscles, especially for children. Make sure to have regular checkups so your healthcare provider can detect any problem early on. The chances of spondylolisthesis coming back or recurring are higher if a grade was higher. For people with a minor slippage, the condition may never come back. Step to reduce your risk of spondylolisthesis. Do regular exercises for strong back and abdominal muscles. Maintain a healthy weight. Excess weight puts added stress on your lower back. Eat a well-balanced diet to keep your bones well-nourished and strong. Will spondylolisthesis go away on its own? Well, the condition won't go away on its own. You can often experience relief through rest, medication, and physical therapy. Can spondylolisthesis be reversed? Non-surgical treatments cannot undo the crack or slippage, but they can provide long-term pain relief. Surgery can relieve pressure on the nerves, stabilize the vertebrae, and restore your spine's strength. What can I do about pain from spondylolisthesis? First, take a break from strenuous activities and exercise. Try over-the-counter medications to relieve pain and inflammation. And make sure to see your healthcare provider who can help you figure out next steps. Foods to avoid if you have spondylolisthesis. First is sugary foods. Sugary foods are among the worst foods that you can eat. Not only can sugary foods trigger inflammation, but they can also cause weight gain. Excess weight can worsen back pain. You should also avoid foods with artificial sweeteners because they can also trigger inflammation. Next is vegetable oil. Most vegetables are high in omega-6 fatty acids. These fatty acids are not necessarily bad. However, when you have more omega-6 fatty acids in your body than omega-3 fatty acids, this can trigger an inflammatory response. Next is refined grains. It is best to eat whole grains instead of refined grains. Pizza, cereal, and white bread are some of the foods that are high in refined grains. Foods that are high in refined grades can cause an insulin spike. This can cause inflammation. Next is dairy products. Milk and other dairy products are often promoted as being necessary part of healthy diet. However, dairy products can trigger inflammation. Many people are lactose intolerant, which means that their bodies have a hard time digesting dairy. Next is processed corn. Corn can be healthy. However, when it's processed, it is only healthy to eat. Processed corn can trigger an insulin spike and inflammatory response. If you choose to eat corn, then you will need to make sure that it is unprocessed. Last is food with chemicals. It is best to avoid foods with chemicals and eat as natural as possible. Foods with coloring, additives, and preservatives are not recognized by your body. That is why an inflammatory response is triggered when you eat foods with chemicals. Make sure that you read the food labels before you purchase anything from the grocery store. And for the exercise for spondylolisthesis, first is pelvic tilt. This is to strengthen your lower abdominal muscle and stretch your lower back or the lumbar spine. Next is knee lifts. This is to stabilize your spine and strengthen your abdominal muscles. And last is curl up. This is to strengthen your abdominal muscles and stabilize your core.